students. So the next topic we are going to do is ICP, that is increased intracranial pressure. So the introduction says that it is the rise of pressure around your brain. Okay, that means the cerebrospinal fluid which is surrounding the brain, its amount is increased in the brain on a specific part. Okay, and it is causing problem for the brain to work. That means that increasing pressure of the CSF will increase the blood also, and that can cause the injury to the brain. And even if you are having some tumor, it may rupture that tumor also. Okay, so it is a life threatening condition. So any person who is having any symptom related to ICP should be um, given the medical assistance as an emergency. Okay, so the symptoms which will be seen should be like headache, blurred vision, or person will feel less alert than usual, vomiting will be there, or there will be the changes in the behavior, or person may have problems or may be having weaknesses in moving and talking, and that can also be have a feature like lack of energy or may have sleepiness or dizziness. Okay, so the causes, if we talk about what causes this ICP, so the first main cause is too much cerebrospinal fluid around the brain and spinal cord. Okay, that can cause bleeding in the brain or swelling in the brain, and that can lead to aneurysm. Okay, even there will be the blood pooling at the areas in the brain. Okay, so that can cause the brain for an injury, or due to some head injury, or due to some brain tumor, or having encephalitis or meningitis infection, or hydrocephalus, or even if you are having high blood pressure or having stroke. The complication which leads to is because of ICP are seizures, okay, having fits or stroke, your damage to the brain, or neurological damage which we have already done, and even it can lead to death. So the diagnose, doctors first will going to take your history, then he is going to do physical examination which includes the neurological tests for senses, balance and mental status. Then he is going to do the lumbar puncture to check the pressure of cerebrospinal fluid. Then he can also go for CT scan or MRI for checking about the head and brain images for any injury or tumor. So the treatment. We talk about the treatment, then the ICP, which is an emergency. Its treatment include medication to reduce the swelling, okay, or to drain the cerebrospinal fluid to depressurize the area, and even the surgery, that is craniotomy, to remove the part of the skull so that the swelling should be eased there. Okay,